Hi, everyone.
Hey, we're back.
Welcome to our second session of the open mic. Afreen should be coming in a minute. She is our second speaker. But until then, please join our Slido. I will read out the code right now, and then I will also put it into the YouTube chat. So please join. You can ask questions, and if we have a little bit of a break, we can do some interactive activities. So I'll just read out the code, and then I will pop it into the YouTube chat as well. But the code is 227532. Okay, I will put that in the chat. Also, if you don't want to join the Slido, feel free to put questions and comments into the YouTube chat because we are keeping an eye on that one as well. Yeah.
Okay, we're gonna wait maybe a minute or two for free. And if not, we're gonna be talking about another very important topic in cancer research. Okay, as Efrain is not here yet, instead of waiting in complete silence, we're gonna just talk about another topic, which is cancer disparities, which we did touch upon while we were waiting for Maisha due to her Wi-Fi issues in our last live. So Priya, you were the one talking at that moment, so feel free to go now.
Yeah, so I just wanted to bring up this topic around racism. So in school, I took the subject biology, and we were asked to read this book called The Immortal Life of Henrietta Lacks. I believe that's the name. And it covers the story of this Black woman called Henrietta Lacks who had cervical cancer. I'm sorry if I get the story a bit wrong. It's been a while since I read it. But she had cervical cancer, and because of her race, she wasn't treated as fairly as the white patients because of the racism present. So the doctors, they were at that time trying to find a way to grow cells in a lab which could eventually help other patients during other procedures, but they weren't able to do so because the cells kept dying in the dishes. So when they found Henrietta Lacks, they found that her cancer cells actually survived in the dish, so they wanted to do more tests. The problem was, in the initial biopsy, they took a sample of her cells without her consent to use for research, which is obviously an insanely big ethical problem. And it mentioned somewhere else in the book that in the hospital, Black patients were often treated a lot more unfairly, and they were often used for experiments a lot more than the white patients. So that obviously created a huge divide between the races. And as well as taking cells without her consent, when they found out that her cells were immortal, they survived in the lab. When publishing the research papers, they spelt her name wrong. So they used the name Helen, I believe, instead of Henrietta. The family didn't know anything about this. And even when Henrietta Lacks unfortunately passed away, the family were still clueless until the investigators talked to them a few years later. So this, you guys should read the book. It's an amazing book, and it talks a lot about ethics, institutional racism, health disparities. It covers it all. So I just wanted to bring up that book because it reflects what we're going through today with all the racism and the difference in treatment, whether it be in the medical field or anywhere else, really, just in broad daylight. So yeah.
Yeah, absolutely. And we do have this topic as a part of our podcast, so make sure to check that out. We had a podcast member, her name is Ellie Lowe, and she took the responsibility of covering this topic, and it's an absolutely amazing podcast which covers all the exciting things Priya was talking about, which it is a very interesting story, but also important things to be aware of when we talk about racism, both in the medical sphere, but also just in social justice in general. And the fact is that she remains unknown for a majority of people who are, one, cancer patients, but even other than them, in society in general, she's just not a name that's used enough as she should. And that's a little bit about racism historically in cancer research and cancer awareness. Another really important topic is cancer disparities, which links really closely to racism. And it's this idea that some people don't necessarily have the same access to cancer research, cancer treatments, support as necessarily some other people would. And this comes from one, geographic location. It could be racism, it could be financial needs. Some people who live in a less affluent region won't have the access to hospitals compared to other people. And this was actually touched upon a little bit in our previous discussion with Maisha, where she explained how her aunt lived in a village that didn't have access to cancer research and cancer treatments, and they had to go to a neighboring city in India rather than their own hometown in Bangladesh. And it's these sort of disparities that causes a unfair risk for certain communities compared to others, including people of color, people of lower socioeconomic classes, characteristics like that.
Yeah. So it's really an insane topic, the health disparities you see in the medical field and all the various reasons that come about, the lack of awareness around these health disparities. And most people only know a few reasons, the more common reasons, so racism and economics, but there are obviously a lot more that need to have more awareness around them.
Yeah. These disparities are often measured through very common terms that we use to just understand cancer in general, which includes incidence rates. So that's the number of new cases a certain group has in a certain amount of time, which is usually annual. Mortality rates, which is similar to incidence rate, but it measures the number of deaths caused by, in this case, cancer and sometimes specific cancers. Survival is how long these people are able to live after diagnosis, which comes in if they're able to receive the correct sort of post-treatment support, if that's through medication, if that's the right amount of checkups to ensure that they are being treated at the correct stages. Screening rates, which is how often they're able to get screening. Survivorship, which is actually a very interesting topic, which deserves its own time, is the quality of life after treatment, which isn't necessarily a medical thing, but for example, if someone were to live in a region with higher pollution, of course, that's bad air quality, which is bad for the lungs, which can have various complications relating to cancer and cancer diagnosis. It can also just be the sort of lifestyle that they are forced to live if they're not able to get the correct hours of rest that they need, if they have to work multiple jobs, if they need to have really high levels of commute, which can always be dangerous for health. And also stage of diagnosis. This can be, for one, some communities have just cultural stigma where they don't go to the doctor as soon as they see some sort of risk, but instead are not that comfortable with hospitals, so they wait for longer periods of time. This can come from, in the US, a lack of health insurance is always a big problem. People aren't willing to go to the hospital for any problem that they see because it is, of course, extremely expensive without any sort of free healthcare. Even emergency services can be an incredible amount of money that a lot of people can't afford, which then causes the stage of diagnosis to be a lot later compared to someone who is able to reach the correct doctors and hospitals and is willing to go to the hospitals to get their diagnosis. Yeah, anything to add?
Yeah, I just wanted to talk about the environmental and medical side of the common causes, Environmental. People who live in poor communities have a higher chance of being exposed to more cancer-causing substances. And this can obviously impact their treatment, as they may not have um, enough money for the treatment, as we brought up with the financial disparities as well. And then there's the medical side of it, as we mentioned with Henrietta Lacks. There's a lack of diversity in clinical research participation with regards to racism, as well as location-wise. So a lot of people don't have the chance to participate in such amazing research, which could improve their quality of life and their treatment plan.
Yeah, and in addition to those issues, there are two other really important common causes, which are financial, which Priya has touched upon, and also racial, which we did talk about as well before, just this sometimes it's conscious, sometimes it's unconscious bias, one from institutions towards people, being willing to support someone who physically might not be of the affluent community, which in the US a lot of times African Americans face an institutional bias against them when it comes to receiving the correct amounts of treatment and at the correct times. It can also be from the people towards the institutions. Some communities don't prefer to go to the hospitals, and a lot of countries have several home treatments. I know personally of in India, there's a lot of home treatments that goes around, and some of them are healthy, while a lot of others are misinformation that gets spread that in fact a lot of times calls hospitals a money-making scheme for Western big businesses, which for many situations isn't, and these institutions are there to help populations. And this sort of misinformation can be related to racial, socioeconomic class that can all affect the sorts of treatment people are able to receive.
Yeah. Just wanted to share a small statistic that around 4.1 million people in the US are uninsured, as well as racial and ethnic groups are more likely to be uninsured, which, bringing it back to the financial disparities, this obviously impacts the quality of treatment and the stage at which a patient can be diagnosed. Obviously, if people do not have the capability to pay for certain treatment or certain tests, the cancer goes unnoticed and undiagnosed, and it makes their quality of life a lot more harder and a lot more painful. And yeah.
Yeah, and a really horrible but unique trait is that in the US, the types of people, communities that are uninsured are more likely to be people of color. In the US in 2013, 26% of Hispanics, 21% of African Americans were uninsured, while only 12% of the white population were uninsured. And that isn't necessarily to be due to any sort of racism. Sometimes it is, but a lot of times it's just socioeconomic class that's just institutionalized, and that people of color are just more likely to be less affluent compared to wider communities, which causes an unfair advantage for people, or an unfair disadvantage for people of color to just be uninsured, which increases their risk of being diagnosed at a later stage, not receiving the right treatment. So that was our little presentation on cancer health disparities. I hope that was helpful for y'all. We are going to close this live stream and start up a new one at 3:20 for our next speaker. And make sure to join us for that. Priya, anything to add?
No, just see you at the next live stream. Join the Slido and comment in the YouTube chat box any questions, comments, concerns.